relationship to this baby and this pelvis?
High.
High, right? We want this to be up in the fundal portion, up here. This would be an anterior placed placenta, and this would be a posterior placenta, okay? If it's down here, remember, what's this called? Previa, right. I mean, any aspect where it touches it, anything at all like that. So you can only imagine when that cervix starts to dilate, you can have some serious bleeding issues. Okay, so we want our baby to be head down, and remember, what is this bone called? Occiput. So this is occiput anterior, and we love that, right? Okay. This is occiput posterior, and what does that mean for this right here? Well, first, look how long the labor is going to be, because the baby's head has a harder time getting through there. So it's a longer labor, and what kind of pain are you going to have? Back pain. So we want to turn interventions side to side, try to turn her, walk her, do everything to get this, the mom, yeah, to get this baby to turn. Okay, so now we're going to do Leopold. Oh, what was this position? Let me put my placenta back up here. So remember, what was this one when they're crisscross applesauce? Complete breech. Is that coming out vaginally? No. And remember, what's this one? That looks funny, doesn't it? This is frank breech, right? Remember, can this one deliver?
No.
It can. It can, especially if it's like this. If it's like this, we have a high likelihood that this, because is the chin going to get hung on here? No. Do we want it to deliver ever breech? We don't. But we know for sure this is not coming out. There's not enough room. Crisscross applesauce, there is absolutely no way that this baby is coming out. Okay? And this would be a sacrum presentation. Remember, what did I tell you on testing? You want in what? Occiput. Occiput. Or posterior. That just means heads down, right? So this is complete breech. This is never coming out. I'm trying to do like Indian style, right? That's never coming out. This frank breech may come out, especially if it's a posterior presentation, okay? Because there's nothing, you know what I mean? But the head still can cause you problems. And then remember, what is this one called? Remember that?
That's trouble.
Yes, trouble, yeah, for sure, Elizabeth. Footling breech. Remember? Footling breech. There's a foot coming out. Okay? Footling, yeah. Okay, what is this one? Transverse. Is it ever coming out? No. And remember, what is this one? Oblique. Okay, all right. So now that we've got all that information, we want to do a Leopold's maneuver. Everybody turn your head. I'm going to put this baby in a certain way, and we're going to, everybody turn around. Turn, turn, turn. Okay. So now you guys, I want to show you Leopold's maneuver. Okay, everybody turn it back. So number one on Leopold's maneuver is you feel what's in the fundus. Okay? So I'm going to feel up here. This is Leopold's maneuver number one. Okay? And I don't feel anything in the fundus. It's all mushy up here. On the sides, I feel little tiny bony parts. I feel little tiny bony parts over here, and I actually feel something hard and round over here. Okay? Number three is now, here's my pelvis. I'm trying to find what's in my pelvis, and I don't feel anything in my pelvis. Okay? And then number four, I'm going to come here, and I'm going to see if it's engaged or what's going on. So what do you guys think that our position is?
Transverse.
Or transverse. So let's see. Transverse. Awesome. So on Leopold's maneuver and on test.
What was the other option other than transverse? Someone said
oblique. Oblique is like that.
Oh, okay.
Okay. So it would have felt very similar, but on Leopold number 2, when you feel something hard and round, that's the sides. Okay. Now let's talk about Leopold's with our head down. Sorry, baby. My poor baby gets beat up. Okay. So if we're doing Leopold's number 1, remember that's of the fundus. I feel tiny, small parts leaking out the top of my fundus. So you want to feel the top of the uterus. If you feel tiny, small little parts, that's awesome. Number 2, you want to feel something smooth and flat. You guys see that? Number 3, I feel something large, hard, and round. Okay? And then number 4, I'm going to feel the relationship of the two. So I can do on the sides. I can go like this. It's just a confirmation. So 1, 2, 3, and then 4 is confirmation, okay? So on Leopold's number 3, I feel something large, hard, and round. So what do I have? Head down. Clinically, on the decision you make, do you want to start the induction that was ordered?
Well, you could.
Could you? What if
Yeah,
it
'cause
was,
the occiput's down.
there you go. What if, Michelle, clinically, you had orders to start an induction on Leopold's maneuver number 3, there were small parts?
It would be breach.
Do you want to start the induction?
No.
Those are big clinical decisions that you'll have to make on the test.
And then at that point, you just consult, sorry.
Yeah, we're gonna call, get an ultrasound, right?
How much pressure is safe whenever you're assessing? Like,
Pretty decent pressure.
really? Because I
Mhm.
always feel. I mean, my sister's pregnant, so
Yeah.
but I always feel nervous, like
Yeah.
pushing on there that I'm gonna like bust the sac
Nah,
or something.
What about an
Good.
abruption? Could you do an abruption with Leopold's maneuver
Nah,
or
the
no?
likelihood is slim because
Okay.
it's usually protected up here and you're like palpating like this. You know what I mean? Like you're not,
You're not trying to dislodge.
you're not, yeah, you're not,
Not like the twisted.
yeah, not like the twisty.
What's that term when you twist?
External version.
Yeah, I mean that takes like some muscling.
2 people.
Really?
Like, so she's the doctor. So here's what I'll do is the doctor will say, okay, I got it this far. They'll say, Danny, hold here. And
then
you'll
you
hold there.
grab-
Then I'm going to reposition my hands as the provider. And then
Just
this,
run it.
yeah, it takes 2 people. It's a big deal. And then, of course, remember, you run the risk of abruption. Okay, so now let's just talk about fetal size and McDonald's rule.